The Do's and Don'ts of Fasting with Diabetes. By Medical ICT Solutions. Are you living with diabetes and considering fasting? Fasting can have many benefits for people with diabetes, but it's important to approach it with caution and careful planning. In this video, we will cover the do's and don'ts of fasting with diabetes, including how to adjust your anti-diabetic medications during fasting and precautions to take to ensure your safety. So, if you want to learn more about how to safely fast with diabetes and potentially improve your health, be sure to watch until the end of this video. And don't forget to subscribe to our channel for more diabetes-related content. First, let's discuss the do's of fasting with diabetes. According to the International Diabetes Federation's 2018 guideline, people with diabetes should consult with your healthcare provider before beginning a fasting regimen. It is important to consult with your healthcare provider before starting any type of fasting regimen, especially if you have diabetes. Your healthcare provider can help you determine if fasting is safe for you and provide guidance on how to adjust your medication and monitor your blood sugar levels. 1. Monitor your blood sugar levels regularly during the fast. It is important to monitor your blood sugar levels regularly during fasting, as fluctuations in blood sugar can be dangerous. 2. Stay hydrated by drinking plenty of water and other non-caloric fluids. Fasting can be dehydrating, so it is important to drink plenty of fluids to stay hydrated. Water is the best choice, but you can also drink other non-caloric fluids, such as tea or coffee. 3. Break the fast immediately if blood sugar levels drop too low or rise too high. If your blood sugar levels drop too low or rise too high during fasting, it is important to break the fast immediately. You can do this by consuming fast-acting carbohydrates, such as glucose tablets or a small amount of fruit juice. 4. Be prepared with fast-acting carbohydrates, such as glucose tablets, in case of a hypoglycemic episode. Hypoglycemia, or low blood sugar, can occur during fasting, especially if you are taking medication to lower your blood sugar levels. 5. Adjust your anti-diabetic medications under the guidance of your healthcare provider. If you are taking anti-diabetic medications, such as insulin or oral medications, it may be necessary to adjust your medication regimen during fasting. 5. This should be done under the guidance of your healthcare provider, as adjusting your medication without medical supervision can be dangerous. 6. Be mindful of the type of fasting you are doing. There are different types of fasting, and some may be more appropriate for people with diabetes than others. For example, intermittent fasting may be safer than prolonged fasting. 7. Be prepared to break the fast if you experience any symptoms. It is important to listen to your body during fasting and be prepared to break the fast if you experience any symptoms, such as dizziness, lightheadedness, or weakness. These symptoms may indicate that your blood sugar levels are too low, and breaking the fast may be necessary to prevent further complications. By following these do's, people with diabetes can safely fast and potentially reap the benefits of fasting, such as improved insulin sensitivity and weight loss. Now, let's talk about the don'ts of fasting with diabetes. People with diabetes should avoid fasting without consulting your healthcare provider. It is important to consult with your healthcare provider before starting any type of fasting regimen, especially if you have diabetes. 1. Fasting for extended periods of time. Prolonged fasting can be dangerous for people with diabetes, as it can lead to severe fluctuations in blood sugar levels. 1. If you are considering fasting, it is important to choose a safe and appropriate length of time based on your individual health needs. 2. Engaging in rigorous physical activity during the fast. Vigorous exercise can also cause fluctuations in blood sugar levels, which can be dangerous during fasting. If you do choose to exercise during fasting, it is important to monitor your blood sugar levels closely and adjust your medication and food intake as necessary. 3. Eating large, heavy meals during the non-fasting period. Overeating during the non-fasting period can lead to weight gain and higher blood sugar levels, which can be harmful for people with diabetes. 4. Skipping medication doses without consulting your healthcare provider. If you are taking medication to manage your diabetes, it is important to take your medication as prescribed by your healthcare provider. Skipping medication doses can lead to dangerous fluctuations in blood sugar levels. 5. Ignoring symptoms of low or high blood sugar levels. It is important to pay close attention to any symptoms of low or high blood sugar levels during fasting, such as dizziness, confusion, or blurred vision. 6. Fasting without being prepared. Fasting can be challenging, especially for people with diabetes. 6. It is important to be prepared with the necessary tools and resources, such as glucose tablets, snacks, and water, to help manage any potential complications during fasting. It's important to note that adjusting antidiabetic medications during fasting is crucial to maintaining proper blood sugar levels. For example, people taking insulin may need to adjust their dose or timing of administration during fasting. Additionally, there are certain precautions to take while fasting. People with diabetes should 1. Not break the fast with a large, high-calorie meal. 2. Avoid sugary drinks and high-carbohydrate foods. It is important to avoid sugary drinks and high-carbohydrate foods during fasting, as they can cause spikes in blood sugar levels. Instead, choose foods that are low in carbohydrates and high in fiber, such as vegetables, nuts, and seeds. 3. Be prepared to break the fast if necessary. It is important to listen to your body during fasting and be prepared to break the fast if you experience any symptoms, such as dizziness, lightheadedness, or weakness. These symptoms may indicate that your blood sugar levels are too low, and breaking the fast may be necessary to prevent further complications. 4. Seek medical attention if necessary. If blood sugar levels become dangerously low or high during fasting, it is important to seek medical attention immediately. Symptoms of low blood sugar levels include sweating, shakiness, confusion, and irritability, while symptoms of high blood sugar levels include increased thirst, frequent urination, and fatigue. 5. Consult with your healthcare provider. It is essential to consult with your healthcare provider before beginning a fasting regimen to ensure that it is safe for you. They can provide guidance on how to adjust your medication and monitor your blood sugar levels during fasting. By following these precautions, people with diabetes can fast safely and potentially improve their health. It is important to always listen to your body and seek medical attention if necessary. Consulting with a healthcare provider before beginning a fasting regimen is also crucial to ensure that fasting is safe for you. In conclusion, fasting with diabetes can be challenging, but with proper precautions and guidance from a healthcare provider, it can be done safely. The do's and don'ts of fasting with diabetes are important to follow, as is adjusting antidiabetic medications under medical supervision. Precautions such as monitoring blood sugar levels regularly, staying hydrated, avoiding sugary drinks and high-carbohydrate foods, and being prepared to break the fast if necessary are also essential. If you found this video helpful, please consider subscribing to our channel for more diabetes-related content. Don't forget to like and comment below to let us know your thoughts and experiences with fasting and diabetes. By working together, we can support each other on the journey to better health. Thank you for watching.